Thank you so much for watching Imani Television. Welcome to another episode of Health, Hygiene and Wellness. My name is Barasa Saenyi, and today in the program we have Dr. Wambulwa. We are still discussing about cancer. Remember that the month of February we're still creating awareness to everyone about the disease called cancer. And here today we are going to discuss about colorectal cancer as well as prostate cancer. So stay tuned to the show till the end. I hope you'll find it very insightful and also educative. Karibu sana daktari.
Thank you so much.
Yes.
Yeah.
I hope you have had a good time.
Yes. Yeah, been fine, thank God.
Since we left the other day and we were discussing generally about cancer, today I would like us to discuss about colorectal cancer as well as prostate cancer.
Yeah, true.
To begin with, colorectal cancer.
Yes.
We can assume from the wording that it is about cancer of the colon.
Yes.
What else can be said about colorectal cancer in the beginning?
I think maybe for the new viewers who didn't get the first topics on cancer, it's good to understand what cancer is.
Yes.
Cancer is a disease that is characterized by abnormal multiplication of cells, abnormal cell differentiation. There is abnormal shape of the cells. You know, there's a way God made our cells in our body, and they are supposed to actually maybe multiply at the right time, stop multiplying at the right time, differentiate at the right time.
With the right rate.
Yeah, with the right rate, and maybe change shape with the right rate. But when cancer comes in, there is something that takes over the multiplication of the cells, something else takes over the changing of the cell shape.
Yes.
And that is what is cancer in a nutshell. So if you hear of cancer, it means your normal cells have become abnormal. So they start eating up the normal cells. They start using blood from the normal cells. That's why you see most patients have anemia, because the feeding of abnormal cells cannot be easy. So that's why you develop anemia, you will develop a swelling, because there is no control over these new cells that have come in. So that is basically what cancer is. Narrowing down to colorectal cancer, as you've said, colon, there is colon, then there's rectal, which means it's a cancer of two organs in the body. That is the colon and the rectum. So the colon is part of the large intestines. Then the rectum is the part that just is near the anus. So the one that maybe once if the food has been processed, the stool has been processed, it passes through the rectum then to the anal opening. So actually it's a cancer of the colon and the rectum. The reason why we call it colorectal is because whenever you have cancer of the colon, it easily moves to the rectum, but not necessarily that when you have colon cancer, you will still have rectal cancer. But we call it colorectal because they are one and the same, because the distance between the colon and the rectum is so near that you can't miss to have a cancer in the rectum when you have cancer in the colon. Yeah.
All right. You've just differentiated the two terms that I wanted you to do, and it's good about that. Again, how can someone differentiate the pain of colorectal cancer and ulcers?
Very difficult. In fact, that's a very good question, because most people have been treating ulcers thinking it's ulcers, and yet it's colorectal cancer, because it comes with bleeding. Ulcers comes with bleeding. There is that pain after maybe eating. There is distension of the abdomen. There is fullness. There is gas. You know, those symptoms of ulcers that people usually feel. After you eat anything, for example, beans, you start feeling you are full, and maybe there's constipation. That is maybe a colorectal cancer. But most people in early stages, they treat it as ulcers. Until late, when it starts bleeding, that's when most doctors and most patients want to be concerned. They come to hospital. We do now the invasive procedures that will help us identify if it's a cancer. So to people who are watching, maybe it's good whenever you have ulcers, it's good for you to just go for screening for colorectal cancer. It costs nothing. Because yes, you know it's ulcers, But what is wrong with you screening just to know if it is cancer? For example, if you have malaria and you've taken, what do we call the drug for malaria? AL?
Yes.
Yeah, for the third day, the malaria is not going off. What else do you go for? Will you go for malaria again?
No.
You will always even advise the doctor now, just check if I have pneumonia,
Yes.
or maybe I have typhoid, or I have any other condition that could be causing this, because I've already taken the full dose of malaria. But people have been on ulcer medications forever. If you suggest to them to go and screen for cancer of the colon, they don't want.
That is where they draw the line.
Yeah, that's where they draw the line. But if somebody comes to you with malaria on the third day and it's not recovering, and it's giving them that headache and whatever, the joint pains, they always want to tell you what to do. They will tell you, go and screen me for typhoid. Last year I had typhoid and treated malaria. Malaria couldn't recover, so I went for typhoid.
And Daktari, now you've gotten colorectal cancer.
Yes.
What is the first organ that gets affected when the cancer is spreading?
Yeah, the first steps of cancer, and the reason why we come here on TV is cancer is a slow disease. It's quite a slow disease. For example, for the colon, you will start having things like polyps. Polyps are just growths. Whenever you do an endoscopy, you will see some small, we can call it in a layman's language, mountains in the intestines.
The inner walls of the
The
intestines.
inner walls of the intestines.
Yes.
That's not cancer. We call it benign. But after some time, it changes to become malignant. So that is now the real cancer now, that now starts spreading. It spreads to the rectum. Then after spreading to the rectum, there are several other organs that are near the rectum. Whenever it pops the intestines and maybe cuts off the lining or the wall, now it spreads. There are several ways of cancer spreading. It can spread through the lymph nodes. Remember, the lymph nodes are everywhere in the body.
Yes.
It can spread through blood, or maybe cell to cell. Cell to cell means it moves from the rectum to the colon, or maybe from the colon to the rectum, or rather it moves even to the liver. It moves to the underlying organs around there. If it's a woman, it can even move to the uterus. If it's a man, it can move to the prostate. You see? So the nearby organs near the rectum, or the bones, they also have the pelvic bones near the rectum,
yes.
which are easily, those are the first organs that the cancer can spread to. Yeah.
All right. Now, I've realized that I'm having pains inwardly.
Yeah.
What can be the outward signs for colorectal cancer?
I always have a disclaimer there to the viewers and even to you that cancer does not have symptoms in the first stages. Cancer comes there to stay, and the body thinks they are just cells that could have been there. So the body does not fight it, So because these are just cells that have taken over the DNA system of the body to replicate, to multiply, So there are no symptoms in the first stage. And that's why we come here, even we are creating this awareness month, like the month of February, just to talk about cancer, to tell our people that this is a disease that will affect you, and yet you don't have any symptoms in the first place. But lately, you will realize that every time, at first stage, every time whenever you eat food, there is constipation, you stay 3 days, 4 days without passing stool. Then whenever you go to pass stool, your stool is hard. The first stages.
That's abnormal.
That's abnormal.
Yes.
So you need to see the doctor to just identify why. There are some drugs we prescribe, like people who have diabetes. There are drugs we prescribe that can cause constipation and hard stool. So you don't have to worry. People fear that whenever they come to us, we'll tell them you have cancer, then they die. No, you just have to be sure it's not cancer. That's the first thing. Then if it's a side effect of the drugs, we'll withdraw the drug, then you continue with your life. Because for sure it's not good, it's not comfortable for somebody to stay 3 days without passing stool. That's number one. Number two, you will also have maybe swelling of the abdomen. Abnormally. Yeah, there's abnormal swelling of the abdomen without pain. When there is a growth in your colon, it does not give you pain. And do you know why there's no pain? It's because the intestines don't have nerves, you know. That's why even if somebody is stabbed in the abdomen, they don't feel pain. They just come to the hospital with a knife in their belly and they are just walking, you know, they don't have pain. Not like if you are stabbed in your chest or somewhere else. So the intestine, the way God created the intestines, they are not innervated, they don't usually give you a lot of pain. So whenever there is even pressure symptoms and growth, there is no pain. That's why we miss to diagnose colorectal cancer.
Then how does someone realize that now my cancer has spread, my colorectal cancer has spread all over?
By the time of spread, the patients usually will come to the hospital because if you allow me to go back just to finish on the symptoms, as I will come to the spread as I talk about those symptoms. You know, after that swelling of the abdomen, this is a progressive disease, you know. Later on, you'll realize now there is complete obstruction of stool because now the cancer has grown to an extent that there is no opening in the rectum, you see. So when there is no
polyps have blocked the intestine.
Yeah, the polyps are not cancerous. Those ones are benign. So when we talk about cancer, the polyps are not there. It's cancer itself because the polyps are not cancerous. So sometimes people can live with polyps and they never develop cancer. But whenever cancer is there, it blocks the intestine. So this person cannot pass stool. Then later on, they might see blood in stool. And we usually encourage people, whenever you see blood in stool, come to the hospital. We'll do what we call a stool test that will tell us if it's cancer. Whenever you start seeing blood now, that's where there is likely of spreading. You know, whenever there's blood in your stool, your cancer might have started spreading to other organs. Then also whenever you have swelling of your abdomen, probably the cancer has spread even to the small intestines. There are some patients who feel backache. I wanted to say that. This backache might mean that the cancer has spread to the bones. You hear? Some patients might have blood in urine. Whenever you have blood in urine, the cancer might have moved from the colon to the bladder because the bladder is nearer the colon and rectum. So those are the symptoms. You might just start seeing blood in your urine and yet there is cancer that has spread. Plus swelling of the lymph nodes. You see, there are some lymph nodes that swell near your inguinal region. I don't know how we call the inguinal region. The inguinal region is the point near the top part of your lower limb. There are some lymph nodes that swell. Whenever you have a wound on your leg, there is something that swells here that's usually painful.
I get it.
So sometimes whenever you see that thing swelling and you don't have a wound, start suspecting there is a problem in your stomach, in your abdomen, and that is could be colon cancer. So those are the symptoms, and whenever there is some of the symptoms I've mentioned, it has spread.
Again, is it the colon only that doesn't work well when you have colon cancer?
In the first stage, it's just the colon alone. But you know, the way intestines work, they always transfer food. You know, once digestion starts in the mouth. Whenever you have had your food, there's a digestion that starts there. Probably the starch, it moves. You know, your teeth will chew some part of the food. Then the smaller particles will move to the intestines. So in the small intestine, there will be some digestion. Then in the large intestine, there is reabsorption and removal of the waste products. So whenever there is a backlog down there, probably in the colon, so the whole digestive system will be affected. In fact, you won't even have appetite. There is loss of appetite. Those are some of the symptoms of colon cancer. Loss of appetite, loss of weight, because there's no reabsorption. Remember, the colon is the organ that is helping us to do reabsorption. So how will you get the nutrients? There are no nutrients being absorbed. So that's why somebody who has colon cancer, whenever it's full-blown, you lose weight because there's no food that is getting in. So it's not the colon alone. It starts there, but it affects the entire system.
Can we categorize colon cancer as a lifestyle disease?
Yeah, it is. It is. All cancers are actually lifestyle diseases. You know, before those days before we took the Western life, people didn't have cancer. If you look at the people who did research in Africa, unfortunately, we didn't have many people doing research in Africa. But The people who did early research in Africa couldn't find cancer, but nowadays there is cancer. People are living with cancer.
Yes.
It's a lifestyle disease, and the risk factors will be mostly our diet. We eat most of the food, the fast foods. Easy, we call them chipsy, chipsy, the nyama choma. Those things are causing cancer because whenever you take the fried foods, that just frying of your food, it gives you a risk for the colon cancer. Then nyama choma is one of them. It causes cancer. That soot, that black soot, it causes cancer. There is also cigarette smoking. People who smoke cigarettes are at a high risk of colon cancer. And also alcoholism. Alcoholism has been seen. If you take alcohol in your young years, when you reach 50 years, you have a risk of developing colon cancer, because especially the different types of alcohol, the locally brewed changa, more serious, the distilled ones, all types of alcohol actually, including even wine, if taken in excess, can cause cancer. Plus lack of exercise. Did you know that lack of exercise causes cancer? There are people who just stay in offices, they don't do exercise. They come to office in the morning, they stay there. In the evening, they are back to their car or motorbikes. They go back to the house. They don't do anything. After 50 years, they can develop cancer. Another risk factor is just aging. You know, when you age, your organs tend to change. The degeneration of the colon. So that's why colon cancer is even more common in those who are above 50 years. It's not common in the young people. Yeah.
All right.
Yeah.
How can we prevent it? How can we prevent?
Prevention, just as I've said, people need to do exercise. The men and women who smoke need to stop smoking. There is no option, but you have to stop smoking.
Yes.
Because by the way, I always tell people, when you want to start smoking, you need to have a plan of stopping smoking, because you cannot keep on smoking in front of your grandchildren, you know. Stopping smoking is very hard. So people need to stop smoking. Secondly, these fast foods, hizi kuku zenye zinazunguka kwa
barbecue.
kwa kio. We are not saying the hotels are doing a bad thing. They are also in business, but it's you to regulate yourself, you know. When it's there, who said that you need to eat a whole of it? You just take a small piece and don't eat it every day, because it's bad. Whenever you eat it every day, it's bad. The chipsy, the nyama choma, the alcohol, you need to stop it. Then you need to do exercise. The carbonated drinks, soda has been there for many years, but there are people who overuse it. It will cause colon cancer. There are other preserved foods. The preserved foods are not good. You need to avoid the preserved foods, because the preserved foods, they have some chemicals. Then the refined foods also, the ones, especially I can just say the foods that are always in the shelves, they always a problem. Just get food from your farm and eat it. It is cheaper, then it's also more accessible, and it's safe than going to the shelves and buying the food always. It's not bad for you to buy food from the shelves, but not every day. That will help you a lot. Yeah.
And before we take our short break, how do you treat colon cancer? Radiation or surgery?
Yeah, it depends with the stage, and that's where the rubber meets the road, because most patients are coming to us after treating ulcers for 10 years. It's already full-blown cancer. So most of them, we do palliative care, where we don't intervene, because it has spread even to the bones and to other parts of the body, the spinal cord. There is already paralysis of the lower limbs. So there's nothing we can do there. But at least there's something we'll do. We'll manage the pain. We'll also help you maybe go through palliation. But for the early stages, if it's just in the colon, we'll just remove part of the colon that is affected, then reconstruct it, and you continue having your normal life. Or rather, if it's in the rectum, we can remove the whole rectum and do an artificial rectum. That means you will have what we call a colostomy. Maybe stool might be passing from the other part, not necessarily the anus, but probably from your abdomen. maybe the left or the right side. So it depends. If it's the rectum that has been affected, we remove the whole of it. Then we create an artificial rectum, and you continue with your life, because after all, a rectum is just a rectum, and you can create an artificial one and you continue with your life. So whenever you come to us early, we can. But if it has spread to many other organs, you know, you can't remove all the organs.
Yes.
So we can do chemotherapy, we can do radiotherapy, just to make sure there is no more spread to other organs as you continue living. The beauty about colon cancer is that it's a very slow progressive disease. One can live with it for very long. Whenever they are identified, people heal from colon cancer. So it's just us to come to the doctor for screening quite early. Yeah. Yeah.
All right. Now, one last question.
Yes.
What are the chances of living a full life after treatment of colon cancer?
Very high chances, because, you know, these are organs that we call pipes, you know. So whenever we remove the rectum, we give you an artificial rectum, you live with it. So you will just be changing the artificial rectum, probably after 3 months, 2 months, or 2 weeks, depends with whatever you have been given. Then you continue with your life, a bit uncomfortable, not like what God gave you, but you continue with your life. So people will live with it. Then those who come to us who have colon cancer, and we tend to do radio and chemo, they get well, they are okay to live. Yeah.
Wow.
Yeah.
Okay. Thank you so much, Daktari, for such an insightful explanation about colorectal or colon cancer. We'll be back in a short while. Stay tuned to Imani Television and Health, Hygiene and Wellness. Don't go too far.